right. Well, I just want to say good morning or good afternoon or good evening to everybody who's joining us. I know people are joining us as we speak. My name is Haytham Kafarani. I'm one of the surgeons at Mass General and director of the Center for Patient Safety and Outcomes in Surgery at Mass General and Harvard Medical School. But it gives me absolute pleasure to introduce today's speaker of Compass. It's Dr. Neelam Dhingra, who's a good friend, and Dr. Neelam Dhingra, in case you haven't heard of the name, heads the WHO Transformative Flagship Initiative, a decade of patient safety from 2021 to 2030 at the WHO headquarters, Geneva in Switzerland. She's joining us actually from Geneva today. In this role, Dr. Dhingra is really a patient safety star and a leader across the whole world. She leads the WHO's global efforts in providing strategic leadership on patient safety within the context of universal health coverage. This includes the implementation of the 2019 WHO resolution, Global Action on Patient Safety, the World Patient Safety Day, 2021 WHO approved Global Patient Safety Action, the Global Patient Safety Challenge, Medication Without Harm, and many, many other initiatives. She is an absolutely wonderful speaker, and I very much look forward to welcoming her here and listening to her conversation. Dr. Dhingra, it's all yours.
Thank you very much, and good afternoon, colleagues. And Haytham, I really appreciate this opportunity and to connect with all the audience who are listening to me today. And it's a huge opportunity for me to present WHO initiatives and global initiatives on patient safety. And I look forward to more interactive sessions so that we could have some question answers, and I'm able to give some details of some of the initiatives that I'm going to present. So I'm going to speak about the global efforts in patient safety, the perspective from the World Health Organization. We all recognize that no one should be harmed in healthcare. However, we are fully aware there's a huge burden of unsafe care globally. The evidence suggests that adverse events are likely to be one of the 10 leading causes of death and disability worldwide, and 1 in every 10 patients is harmed while receiving hospital care, even in high-income countries. In the low-income countries, the burden is extremely high, and estimates suggest that in hospitals alone in low and middle-income countries, 134 million adverse events occur each year, and these contribute to 2.6 million deaths annually. This also has a huge burden on primary care as well as the cost. 4 out of 10 patients are harmed in primary and ambulatory care settings, and there are high cost treating for these effects of patient harm. 15% of total hospital expenditure and activities are direct result of adverse events and managing safety failures. And up to 83% of harm to patients in healthcare is avoidable. So that's where the efforts of patient safety are focused on, to address the avoidable harm and take it to zero or eliminate avoidable harm in healthcare. Unsafe medication practices and errors also lead to major patient harm in millions of patients and also cost billions of dollars every year. Patient safety actually is at the heart of universal health coverage. When there are global health initiatives, countries around the world are signing up to the Sustainable Development Goals, and in their journey to universal health coverage, there is actually a major cost of unsafe care. The financial cost of unsafe care, because money is lost in treating safety failures. Either they are readmissions or extended stays and surgeries, and their litigation, legal fees and compensation. So huge financial cost of unsafe care. Similarly, there's a huge burden of harm and mortality and morbidity due to adverse events. And there's huge suffering as well associated with it. In addition, there are excess costs as well of unsafe care, because volume is lost due to that, loss of faith in healthcare system. If patients are harmed in healthcare, they will not come to healthcare system seeking care. So this leads to altered health-seeking behavior, which is counterproductive to the objectives of universal health coverage. Now, I would like to structure my presentation in 4 parts, which is the WHO response and the global patient safety movement, the past, the present, and the future. If you look at the past, which is the foundation of patient safety actually was laid when the first report on patient safety to err is human was launched. And that was on the 29th of November, 1999, when the report was launched, which was actually a pioneering report to open up a new discipline of healthcare in healthcare. And that led to a landmark resolution in 2002 at the World Health Assembly on patient safety. This led to several initiatives like First Global Patient Safety Challenge, which led to the entire program on infection control and prevention. With this challenge focused on clean care is safe care, and also led to release of hand hygiene guidelines. The second Global Patient Safety Challenge also was launched around this time of creating the foundation from 1998 to 2012. Then the second Global Patient Safety Challenge on Safe Surgery, Saves Lives also launched. And I'd like to go through some of these initiatives. Now, priority areas in surgery were defined as anesthesia safety, medication safety, prevention and control of surgical site infection, and prevention of wrong site surgery. And also the major risk factors which led to surgical errors were failed communication, staff stress and fatigue, insufficient assessment in the perioperative period, and also lack of continuing medical education and training and opportunities for professional development. There were several tools which WHO developed at that time when the second challenge on Safe Surgery, Saves Lives was launched. And we developed patient safety solutions and Safe Surgery, Saves Lives guidelines of WHO guidelines on safe surgery in 2009, and which gave 10 objectives related to surgical safety. In addition, the very, very well-known surgical safety checklist was also launched. And this introduction of this checklist into the operation theaters, in several studies were done actually, but the one I'm quoting is that in 8 diverse hospitals, it was associated with marked improvement in surgical outcomes, and post-operative complication rate fell by 36% on an average, and death rates also fell by a similar amount. So surgical safety checklist was well taken. Even now, countries are implementing the checklist, and we are now looking into the future, taking forward some of the actions related to the surgical safety checklist. Now, moving on to the phase of rejuvenation, which was from 2015 to 2018, the first Global Ministerial Summit on Patient Safety was hosted by the UK government in London. This was the start of a major political movement on patient safety, where the governments of United Kingdom as well as Germany came together to address the significant harm patients suffer when they access healthcare. And that led to a series of annual ministerial summits on patient safety. The first, as I said, being in London in 2016, which created the foundation of the second patient safety movement, I would say. The second ministerial summit was held in Bonn, Germany in 2017, and that also coincided with the launch of WHO third Global Patient Safety Challenge on medication without harm. The third ministerial summit also was held in this time in 2018 and in Tokyo, and it was hosted by the Japanese government, and that led to the Tokyo Declaration, which was issued by the Japanese government and the participants who attended the summit. More and more health ministers and high-level officials and experts to get the state-of-the-art knowledge and how to apply that into global action for patient safety were some of these key features which came out of the Ministerial Summit series. And that was a time when WHO also was revamping its program, and one of the very foundational initiative we had was creating a network and bringing together all the international patient safety leaders and community to communicate in real time. And that led to a launch of the Global Patient Safety Network. So I'll focus on some of these here. And you can see a picture where several global leaders and political leaders were committing to patient safety to the summits in 2016 in London, in 2017 in Bonn, in 2018 in Tokyo, and in 2019 in Jeddah. And even in 2019, when the fourth ministerial summit was held, that led to Jeddah Declaration. And in 2020, Swiss government was going to organize the summit, but it was put on temporary hold. And hopefully the summit series will start again from next year or the year following. But what is encouraging is that there's a huge amount of political support and commitment to this movement. And we are really hoping that the annual Ministerial Summit series will bring together ongoing high-level political commitment for patient safety. During this time, WHO leadership has been fully committed to patient safety. Dr. Margaret Chan, as well as Dr. Tedros, have been fully committed to the cause of patient safety during this time. At the same time, when the summit series were organized, there were also a series of publications OECD brought on economics of patient safety. And that really showed the impact of patient safety or unsafe care on economics, and how investing into patient safety would lead to significant savings in healthcare. And these set of publications, they really were very helpful in building a case for prioritizing patient safety globally. Some of these data was from OECD countries, but some of the data was global as well. So you can see in 2017, coinciding with the second Ministerial Summit, was the release of the first in the series of economics of patient safety on how in hospital care, what is the impact of economics of patient safety. Then the second one was economics of patient safety in primary and ambulatory care, launched at the Japanese summit in 2018. And then there was another one which was launched when the Jeddah summit was organized in 2019. And also later on, it led to release of another report on economics of patient safety from analysis to action. Then there was another report in November 2020 on impact of long-term care, as well as this year in September, there was another one in this series was study safety in workplace and occupational health as the bedrock for national health systems, resilient health systems. So this is really, really an important initiative globally, which has led to prioritizing patient safety in countries around the world and provided some very, very valuable evidence to build the case for prioritizing patient safety. Now, as I mentioned about the Global Patient Safety Network, this network actually brings together all the Ministry of Health focal points on patient safety, all the WHO country offices, regional offices, all international organizations working on patient safety, and experts and students, and anyone who has an interest in global patient safety is on this network. And currently it has more than 2,000 active members, and 146 countries and territories are currently represented on this network, which is a real-time platform for sharing experiences and very inspiring stories about how countries' initiatives are on patient safety, how countries are observing World Patient Safety Day, and organizations and facilities are organizing and taking forward patient safety action has been very, very inspiring and interactive. Moving on to the third phase, which I mentioned about in this past, present, and future of global patient safety movement, 2019 was a watershed moment for patient safety that led to a resolution at the World Health Assembly, and all these efforts, which were in the rejuvenation phase, the Ministerial Summit series, and the political interest actually led to requests for a discussion in the World Health Assembly on patient safety, and that led to a resolution on global action on patient safety in 2019, and patient safety was also recognized as a global health priority by the World Health Assembly. At the same time, as part of this resolution, World Patient Safety Day was established to be observed annually on the 17th of September as an official WHO mandated day, and there are actually altogether 11 days and weeks which are recognized by the World Health Assembly. So this is one of them, which was established in 2019. This year, as I mentioned earlier, the fourth Ministerial Summit was also organized in Saudi Arabia, which led to Jeddah Declaration. And under the leadership of the Kingdom of Saudi Arabia, while they were hosting the presidency of G20, patient safety was included as a standalone agenda item on the G20 during this time. So there were major watershed events which happened during 2019. And I'll just share with you a couple of these again. So 2019, the World Health Assembly recognizing patient safety as a global health priority and adoption of the resolution, World Patient Safety Day. And the resolution also asked WHO to work on a global patient safety action plan, which provides a vision for next 10 years for countries to work towards patient safety in a strategic and operational manner, and to be aligned with the Sustainable Development Goals, so provides a vision and alignment to 2030. So moving on to the vision from 2020 to 2030, that was the time when WHO flagship initiative on a decade of patient safety was launched. And we worked with all member states and partners for formulation of the Global Patient Safety Action Plan, which is a roadmap for next 10 years. And the fifth Ministerial Summit was, of course, planned in 2020, as I said, and we are very hopeful that the summit series would start and continue. And patient safety agenda has also been included in the Italian presidency for G20 as well in this year, in 2021. So a couple of details going into this. The Decade of Patient Safety, which was launched actually in 2020, primarily has a couple of these very, very important streams of work of WHO on patient safety. World Patient Safety Day, of course, developing global campaign and observing the day, and also catalyzing change at facility level. So it's not only a platform for a day to be observed, but it provides a platform for highlighting key issues, as well as urging member states and countries and partners and providing literally a platform for catalytic change and improvement in this. And the Global Patient Safety Action Plan and the implementation of the action plan going forward in the next 10 years. The third Global Patient Safety Challenge, as I mentioned, on medication without harm. A Global Patient Safety Network, as well as a very unique initiative, Global Patient Safety Collaborative, which is to work directly with countries and provide country cooperation and support. And development of guidelines and standards and tools on patient safety. And also, very importantly, to bring patient voice to healthcare and to patient safety. Several initiatives are in this area as well, Patients for Patient Safety, and also to empower patients and enhance patient and family engagement. These are like a couple of key streams of work, and then several others which we are working on. So just sharing some of the images on World Patient Safety Day. And the objective, as you fully recognize, is to raise global awareness on patient safety, enhance global understanding, engage key stakeholders for action, and also encourage development of systems and procedures for reducing patient harm and improving patient safety, and additionally seek commitment and support of member states. And globally now, World Patient Safety Day is also used to showcase improvements and initiatives and successes in patient safety. So the very first World Patient Safety Day was observed in 2019, where a legacy was created, a visual identity was created for patient safety as well as for World Patient Safety Day. And the theme was Patient Safety Global Health Priority, with the slogan, Speak Up for Patient Safety. More than 100 countries observed the day, and world was really painted in orange, because the call for action for global solidarity was lit up monuments and iconic places in orange. And that has also been phenomenal success. So a couple of images we can share with you. Pyramids in Giza, as well as different types of cakes being built up on this logo. Several activities and marches and processions. Countries committed to patient safety and showing global solidarity, and several monuments being lit up, and initiatives and activities around the world. And in 2020, considering the major challenge of safety of health workers, the theme was on health worker safety, a priority for patient safety, with the slogan on Speak Up for Health Worker Safety. And this year, we actually launched a WHO Charter on health worker safety, as well as a set of goals were also launched, which actually provided impetus for countries and healthcare facilities to sign up to these goals and charter and demonstrate their commitment and actually implement the actions which have been asked as part of these two very, very important tools. So WHO Charter, as well as the World Patient Safety Day goals, and these are now being issued every year aligned with the theme of that year. And we have full commitment of Dr. Tedros for the day, as well as for patient safety. So you will find his tweets related to patient safety, as well as on World Patient Safety Day in particular. As I already mentioned, that we launched the charter last year on 17th September, and a set of goals. And these set of goals, which were related to health worker safety, were on prevent sharp injury, reduce work-related stress and burnout, improve the use of personal protective equipment, promote zero tolerance of violence against health workers, and also report and analyze serious safety-related incidents. Moving on to 2020, pictures of 2020, you can see several landmark monuments lit up around the world in orange color again, demonstrating global solidarity for patient safety. 2021, which is the third World Patient Safety Day, just observed less than a month back. It's dedicated this year to safe, maternal and newborn care. And we also launched a set of World Patient Safety Day goals this time, a set of 5 goals, as well as a global virtual conference was organized together for safe and respectful maternal and newborn care. And it brought almost 1,600 participants from 141 countries. So more and more interest and visibility related to World Patient Safety Day. It's a huge platform for global solidarity and in improving understanding about patient safety issues. Again, several important monuments being lit up, and that shows the commitment of countries and governments and partners around the world And I must say that the entire success of World Patient Safety Day goes to the commitment from member states, and also all international organizations who are working on patient safety have taken ownership and leadership. And hundreds and thousands of events are being organized every year. And we actually are putting together summary reports as well, that you can find on our website. So this year, we have so far, in just less than a month, we've collected some information. We have 109 countries reporting that they've observed the day. And so far, we've got pictures of 168 monuments, which are lit up in orange, and extremely important, iconic places which were lit up. Now, the other important initiative, which I mentioned earlier, was the Global Patient Safety Challenge. This was the third challenge in the row of challenge initiatives. These are change management programs, and we identify a topic or a subject which actually is leading to major harm, and they are proven strategies which can be implemented for countries to bring about the change and reduce patient harm. And this challenge was launched initially as a 5-year initiative, but it would be extended for another 5 years. And this was launched at the second Global Ministerial Summit in Bonn, as I mentioned. And you can see a beautiful picture here of the global map with all the pills around, showing it's a global issue and a global challenge. Some of the key products which we have developed for promoting and supporting the implementation of medication without harm is the strategic framework, which identifies 4 key domains in a systems approach, what action is required for medication safety and medication without harm. And these are patients and the public, healthcare professionals, medicines as products, and also systems and practices of medication. And under these 4 domains, there are subdomains under which interventions are being developed for implementation at the facility level and also at the Ministry of Health level, at the governmental level. Some of the technical reports which were developed, because 3 key areas were identified, which is high-risk medications. So you can see reports on high-risk medications, transitions of care, and also polypharmacy. A patient engagement tool has been developed, 5 moments of medication safety, and it's an extremely impressive tool which is very simple from starting, taking, adding, reviewing, and stopping medications. So STARS, mnemonic, in English, of course. And then an app also was developed, WHO MedSafe, for this. And there are several other products which are in the pipeline for development for this initiative. Another important mechanism or pioneering initiative I mentioned was the Global Patient Safety Collaborative. And this has been launched together by WHO and the UK government. And this has 3 strategic objectives on leadership and capacity building through education and training and research. And this model has countries in all levels of WHO and academic partner, and Imperial College London is the academic partner under this initiative. And we have several products which are being developed as part of this collaborative at the global level, as well as country support as well. So leadership competency framework for patient safety, global priorities for patient safety research, and a WHO patient safety curriculum guide, which was earlier issued in 2010, is now being developed as an interprofessional education guide as well to bring new dimensions to education and training on patient safety. Direct support is being provided to 4 countries currently, India, Kenya, Mongolia, and Pakistan, through several mechanisms, of course, policy dialogue and strategic advice, capacity building of healthcare professionals, and technical support and research. Just sharing in some of the images of these products which we have. Patient Safety Curriculum Guide, as I mentioned, which was launched in 2010 and now is being revamped as a modular approach on interprofessional edition. Safe Childbirth Checklist, Implementation Guide, as well as Safer Primary Care, a monograph series, Surgical Safety Checklist. Several countries which developed their national patient safety implementation. India recently developed National Patient Safety Implementation Plan as well. Minimum information model for reporting learning systems, Patient for Patient Safety Initiative. And last year, we actually launched also very comprehensive guidance on patient safety incident reporting and learning systems, and now working with countries to establish these systems. So, and some of the others which we are working on currently are also venous thromboembolism risk assessment tool, as well as applying human factors to healthcare for patient safety. And these are being worked together with the International Society for Thrombosis and Hemostasis, and this one on human factors with the International Ergonomics Association. So we are working very closely with international organizational partners to bring some of these important tools and guidance to countries. As I mentioned earlier, this is again to share with you the G20 Health Ministers Declaration, which was adopted in November 2020 under the Kingdom of Saudi Arabia presidency for G20, and patient safety was on the agenda of this year, last year. And it actually led to several key actions which were asked for patient safety, very specifically to mention creation of a G20 patient safety leaders group as well, which is now getting into function and also will provide the leadership for patient safety at a broader level, with WHO's involvement fully in this initiative. Italian presidency also has patient safety as a legacy item. And there's another patient safety event which is being now planned at the margins of G7 on the UK presidency on the 22nd of November. This year in February, an important report was also released, which was by the G20 Health Development and Partnership, the Overlooked Pandemic, and it was actually looking into the COVID time as well, that patient safety and patient harm are vital. So how to transform patient safety and save healthcare systems. So this actually, again, highlighted and emphasized on the burden of avoidable patient harm. And we had several global leaders who contributed to this op-ed opportunity and provided this excellent publication. So moving on to the formulation of the Global Patient Safety Action Plan, as I mentioned earlier, the resolution of 2019 also asked WHO to work on a Global Patient Safety Action Plan, which is a roadmap for next 10 years. And the foundation for that was actually laid in February last year, when a global consultation was organized where we had more than 40 countries represented and almost all international organizations, more than 120 participants. And that was in a way the last face-to-face meeting before the pandemic. And that led to significant discussions and also creation of a foundation for the action plan. We discussed about 12 thematic areas and several recommendations and actions which came out of this meeting, but then embedded in the Global Patient Safety Action Plan. The purpose of the action plan is very straightforward: to provide strategic direction to all stakeholders through policy actions, provide a framework to develop national plans on patient safety, align existing instruments of strategic nature to promote patient safety in all clinical and health-related programs, and also to provide implementation guidance for the mandate provided by the World Health Assembly resolution. So this is just a picture to share with you the developmental process, and it took about 2 years for us to work on the action plan. We started actually working immediately after the resolution was adopted in May 2019, with scoping a literature review and going through several of reports and studies and articles to start the foundation of the existing knowledge, with several rounds of internal consultation in WHO, within the departments, interdepartmental, as well as WHO regional and country offices. The global consultation, which I mentioned to you, was the expert consultation in February last year. And then we created a drafting and review task force, which then drafted the zero draft and also provided work towards a first draft, which was then put for public consultation from August to September last year as a first draft. And then several extremely useful comments were received from on public consultation, and several partners and individuals and experts provided very, very important comments and feedback to the first draft. And then they were incorporated in the second draft, which was then utilized for a mission briefing to all the countries in Geneva in November. And following that, there was a third draft developed, which was presented to the executive board in January. And following that, we had another presentation to the countries and the missions in Geneva in March. And then we had a fourth draft, or the final draft, which was then submitted to the World Health Assembly in May, which was adopted. And as I'm sure you're aware, then the action plan was also formally launched in August. And this is a picture where we actually launched the action plan, and with full support of Dr. Tedros, Director General of WHO. And this actually just shows the decision which was taken by the World Health Assembly in relation to the action plan. So the 74th World Health Assembly adopted the action plan, as well as also requested WHO Director General to report on the progress of its implementation every 2 years to the World Health Assembly till 2031. So next five World Health Assemblies he would be reporting to the World Health Assembly, and the first report will be now due in 2023. So this is a very effective mechanism, and also to collect information and work with countries and partners, and also WHO's accountability to the World Health Assembly to report back how we are actually working on the implementation of the action plan, which is a 10-year roadmap, but we have to go there step by step. So every 2 years, what progress we can show in action in this action plan. So very impressive launch event where we had, again, all partners and experts and stakeholders. Just to share with you now a couple of details about the action plan, what it is and what it says, and how we are going to implement the action plan. So it provides a vision, it identifies 4 key stakeholders, provides a mission and a goal, and then 7 guiding principles and 7 strategic objectives. And you can see these, the framework of 7 strategic objectives here, which I will also deliberate later on. And then, so this is like the overview of the action plan. And most importantly, I think I just want to highlight here that action by all key partners is essential. So these are the partners in action who are really vital to make it happen, implement. So it's not only governments or only WHO, it's all healthcare facilities, all government institutions and governmental bodies and ministries of health and other governments, other ministries, all stakeholders, patients, patient voice, professional bodies, educational institutions, universities, and medical colleges and nursing colleges. So this is a very broad base of partners where we are urging action to implement this action plan. A vision in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. And you would have already noticed that the actual title of the action plan is, I can show here, towards eliminating avoidable harm in healthcare. So it's a journey where we are working for next 10 years so that we can work towards eliminating avoidable harm, which is in healthcare, both for patients as well as for health workers and any other harm which is taking place in healthcare. A mission to drive forward policies, strategies, and action based on science, patient experience, system design, and partnership to eliminate all sources of avoidable risk and harm to patient and health workers, and a goal to achieve the maximum possible reduction in avoidable harm due to unsafe care globally. Here I'm sharing with you a framework for action, which is a 7x5 matrix. So under these 7 strategic objectives, we have defined 5 key strategies under which action is vital. So it's really a very comprehensive and systems approach to patient safety, and also embeds patient safety as part of health system and vital for health system strengthening. So the first one is policies to eliminate avoidable harm in healthcare, making zero avoidable harm to patients a state of mind and a rule of engagement in the planning and delivery of healthcare everywhere. So just want to highlight here, it's not a goal to achieve zero harm, but it's actually a vision to move towards zero harm. So it's not a target that we have to achieve zero harm, and we are not going to measure zero harm, but it's a journey and we are working towards avoidable harm. And whenever we make policies and strategies, we should have zero harm as a state of mind when we are working and as engaging with partners. The key strategies in this include work on policy, strategies, and implementation framework, resource mobilization, legislation, standard setting, as well as maximizing the impact of certain initiatives like World Patient Safety Day and Global Patient Safety challenges as a whole. The second objective relates to high reliability systems, building high reliability systems and health organizations that protect patients daily from harm. And this particular strategic objective touches upon 5 key strategies, which are about transparency and openness and enabling culture, good governance, leadership capacity for clinical and managerial functions, human factors, as well as patient safety in emergencies and settings of extreme adversities and outbreaks as well. Strategic objective 3 is the one which is directly related to safety of clinical processes and to assure the safety of every clinical process by identifying the safety of the risk-prone clinical procedures, And so identify risk-prone procedures and then introduce safety measures on them. Specifically implementing some of the key initiatives such as the medication without harm, as well as IPC and AMR initiatives, safety of medical devices, medicines, blood, and vaccines as products, and patient safety in primary care and transitions of care. And these are some of the examples of how we have given in this action plan some suggested actions for each of the partners. So if we look at actions for healthcare facilities and services, under this particular strategy of identify all risk-prone clinical procedures and mitigate their risks, taking account of national and local priorities. This one addresses about ask for appointing or designating patient safety officers or clinical risk managers, establish clinical leadership group, identify all risk-prone clinical procedures, and so on. And similarly, for each of these strategies, there are actions, and these actions are for the 4 key partners which we identified. So actions which I've listed here are basically for healthcare facilities, but similarly, the actions for governments, actions for stakeholders, and actions for WHO. So WHO action for next 10 years also is now totally aligned with the Global Patient Safety Action Plan and implementing that action plan. Strategic Objective 4 on patients and family engagement. Of course, extremely important to engage and empower patient families to help and support the journey to safer healthcare through co-development of policies and programs, learning from patient experience, building capacity of patient advocates and champions, and also patient safety incident disclosure to victims and those who are harmed in healthcare, and definitely education, information education to patients and families and community at large, and increasing public awareness as well. A strategic objective 5 on health work education, skills and safety to inspire, educate, skill, and protect health workers to contribute to the design and delivery of safe care systems through patient safety in professional education and training, identifying centers of excellence and building capacity, and institutional strengthening as well, patient safety competencies and regulatory requirements, linking patient safety with appraisal systems of health workers, and also creating safe working environment for health workers. So these are very important for healthcare leaders and managers to work towards safety culture and safe working environment. And safety culture actually is one of the very important guiding principles, which I didn't go into details, but I'm sure if you're interested, you will go to the website and find the document and go through the 7 guiding principles, which lay a very strong foundation for action on these strategies. Strategic Objective 6 relates to information, research, and risk management by ensuring a constant flow of information and knowledge to drive the mitigation of risk, reduction in level of avoidable harm, and improvements in the safety of care. And this particularly addresses patient safety incident reporting and learning systems, information systems, and surveillance system to assess the burden of harm, patient safety research programs, and how digital technology can be applied for patient safety. The strategic objective 7 relates to synergy, partnerships, and solidarity to develop and sustain multi-sectoral and multinational synergy, partnership, and solidarity to improve patient safety and quality of care through stakeholders engagement, common understanding and shared commitment and goals, patient safety networks and collaboration, cross-geographic and multi-sectoral initiatives, and alignment with technical programs, initiatives, all the health and clinical programs, clinical risk areas as well. So this is again very, very important to engage with stakeholders and work together with a common objective. So a couple of strategies which we are implementing to take forward the work on Global Patient Safety Action Plan and the resolution is having patient at the center of a patient-centered approach with health workforce which is empowered and competent and also sufficient in number and works in a safe working environment, the organizational commitment and also the environment. And through several strategies, which is leadership policies and development of strategies, guidelines and tools development, capacity building and technical support, collaboration and partnership, measurement and research and evidence to again inform the policies and also look into progress, particularly in data poor settings. Just to share with you also the ecosystem, and these are actually in the action plan. So if you go through it, you will find this patient safety implementation ecosystem, which provides some upstream factors and some downstream factors and some lateral stream factors related to coordination and collaboration and also several steps which we are suggesting as some major milestones which countries could consider while they're implementing, such as assessment of safety risks and barriers, commitment from political organization leadership, sustainable mechanism for implementation, also aligning the global action plan to national context and priorities, and working towards a national implementation plan and framework, and identifying the models of change for different settings and different levels of healthcare. Coming to it was the end of my presentation, particularly related to how do we now report to the World Health Assembly and how do we assess. And so monitoring and reporting is a very important component of the action plan. And there are 10 core indicators which have been identified and agreed by member states. And then linked with those are also the targets. And then there are several advanced indicators as well, which are for voluntary reporting. So we would be starting collection on baseline data based on these core indicators. Later this year, in the next 2 months, we would start the survey. And so that we have a baseline, and then we would be collecting a follow-up data as well in the coming years, so that we are able to report to the World Health Assembly every 2 years. So just an example of strategic objective 3, which actually has the outcome indicators, while all the other indicators are mostly process indicators. So with each of these 7 strategic objectives, there are 1 or more indicators which are linked. With the number 3, as I said, these significant reduction in medication when healthcare associated infection, and also there's another one on medication related harm. So reduction in these sort of 2 outcome areas are infection and medication related harm, with global targets on percentage of countries that have achieved national targets on reducing healthcare associated infection rate, establishing a baseline by beginning this year and early next year. And then over a period of 10 years, every 5 years, or every 2-3 years, every 2 years, and over these 5 assemblies, we will then be collecting more and more information from countries to reach to the targets, global targets, that 80% of countries by 2030 demonstrate that they have achieved a reduction in healthcare-associated infection, for example. So linked with the strategic objective 3, again, some examples of the advanced indicators, which is the incident rates and reduction related to specific patient safety outcome measures at national, subnational, and healthcare facility level, avoidable deaths due to healthcare-associated venous thromboembolism, avoidable deaths due to healthcare-associated sepsis, missed or delayed diagnosis, inappropriate polypharmacy, perioperative mortality, avoidable deaths due to patient falls during hospitalization, and severe transfusion reaction. So these are, again, a couple of examples we've given of advanced indicators in the action plan for voluntary reporting by countries, depending on the maturity and the development of the reporting system. So a couple of take-home messages, particularly also related to the surgical safety, considering the interest of the participants of this webinar, is to adopt a systemed approach to surgical safety, including all levels of care, develop leadership, both at clinical managerial level, have adequate resources, and also develop a conducive work environment with focus on human factors, protect, educate, and train health workers, empower patient families as co-producers, establish safety culture to promote learning, risk management and improvement approach, sharing of best practices, and also encourage innovation and locally adaptable solutions, commemorate World Patient Safety Day, and also sign up and adopt the annual goals and implement the WHO Global Patient Safety Challenges, all of them, but the third one, which is ongoing, is on medication without harm. And then also establish a mechanism for patient safety measurements to drive change. So I would just like to ask one question to the participants, that how can you contribute to implement the Global Patient Safety Action Plan for safer surgery and also zero avoidable harm in healthcare in general? So with that, I would like to thank you immensely for your attention and for this opportunity to share with you some of the perspectives from WHO on global patient safety efforts. Thank you to all, and thank you so much, Haitham.
Well, listen, Neelam, this was absolutely amazing, and a really tour de force of how the world can come together for a common cause, such as patient safety. There's plenty of stuff that separates us in the world, but something like patient safety is something we really need to empower and bring together. I want to invite, I know some people already contributed questions, and I will start going through them, but I want to encourage everybody who was watching and listening with us to please put your questions, and I will not filter the questions as I told Dr. Dhingra. I will just ask you questions the way they are in respect to your opinion and your inquiries. So let me start. Actually, I had a question for you, and then I will go through the list. It's not 2021 if you give a talk and we don't mention COVID-19 at least once. So my question to you, and please, maybe take a few minutes if you want to answer it, because I know it has several implications. COVID-19 and its impact on patient safety is on everybody's mind, whether it's the impact on the healthcare workers and the burnout that we're seeing, which is affecting patient safety from a capacity, or the impact on the patients with COVID-19, but also the impact of delayed care of the other millions of patients who can't get access to the care. And many of us are feeling, at least maybe in a not measurable fashion, that this year is blowing up in our faces a little bit. So I was wondering if you can take a few minutes to tell us the WHO and your personal perspective on the impact of this pandemic on patient safety in general.
So it's, of course, absolutely vital. Patient safety is one of the is the major casualty, I would say, in this pandemic. And this pandemic has posed the biggest patient safety challenge to the world, because whether it is lack of access or actually increase in adverse events because of several issues of not getting timely treatment or delayed diagnosis, or because of extreme pressure of health workers, and health worker safety directly impacts patient safety. So WHO actually, for COVID, there is a absolutely global initiative of WHO in COVID response. And the major focus of WHO has been, when we are developing and recovering from the pandemic, the system we are developing are safe and resilient. So, and during the pandemic also, there is a continuity of essential health services which are safe. So there were surveys done by WHO. Pulse survey, one of the very famous Pulse survey, demonstrated there were major disruptions in access to essential health services during this time. And also there was actually significant burden of healthcare workers, which led to directly to affecting safety of patients as well. The main objective of identifying health worker safety as a theme for World Patient Safety Day was to bring to the forefront the actual interdependence of health worker safety and patient safety. And unless we really provide a safe working environment, which includes not only sufficient and competent health workers, but an environment where they can operate and they are not going into burnout or psychological, ill health, because this has direct impact on patient safety. So several of these initiatives have been directly to address the impact of COVID on patient safety. And this is a work continuing, because going forward in the recovery phase, and also health system and response connector, we have a major initiative in health system and response connector through the several ACTA initiative, which is looking at vaccines and medicines and diagnostics. How can we develop safer and resilient systems? And all the strategies for patient safety are now being embedded in those directions. So definitely, COVID-19 pandemic is the biggest challenge to patient safety, and the initiatives and actions of WHO are now addressed to ensure that there is a continuity of essential health services which are safe during this time, and also when we are building back better, these systems are safe and resilient.
That's fantastic. Let me go through some of the questions we have here. I have a question from Dr. Rahul Jindal, who's also a great friend, and he's really a leader in the field as well. The question he has for you is the following: there are voluminous documents and academic publications on patient safety. Could or would or should the WHO create a single application for key documents, specifically for low middle income countries? Rahul Jindal, Washington, DC.
Thank you very much for that question. And so there are two, I would say, initiatives which WHO has currently to address the increasing the access to the source materials for patient safety, particularly for low and middle income countries. One is that we actually have a very advanced stage of creation of a global knowledge sharing platform for patient safety, which will be the repository of all patient safety resources globally. And this is going to be hosted by one of the collaborating centers we work in a high-income country to maintain to sustain and maintain this platform, which will be a repository of global resources on patient safety, and which will address all aspects of from policy to point of care to educational and to tools and different guidelines and of different countries as well, not only WHO. So examples from different countries are extremely important, and that's what we are going to include there. In addition, we have also developed some simple tools in which we have actually created an e-library, which is then a simple tool which can be some of these cards, memory cards, or a simple devices where there's not a good bandwidth for internet. So these materials can then be available on simple memory cards as well. So, but any suggestions in this area are very welcome. So one of my objectives of actually participating in this webinar is also to get advice and guidance from participants, because it's very important for us to know what we should be doing, what we're not doing, and so that we can improve upon our strategies and activities as well.
I mean, your humility is fantastic, Dr. Dhingra. I actually have a couple of questions myself, but I'll keep them, until we finish the questions we have here, and they do relate exactly to this. But let me give you this question. It's from Melody Cycli. I believe she is in Lebanon, if my memory serves me well. And she is asking, how will the WHO ensure the participation and engagement of governments who could provide actions and awareness at a national level, enforcing such practices in the local facilities around the world, to be part of the global action plan? Is it voluntary, or will it be up to the local WHO offices to work with local governments?
So I think there are multiple multi-pronged strategy for implementing the action plan, and in this, absolutely vital to have the governmental and non-governmental organizations working together. And I emphasized earlier that this action plan identifies several partners who have to take action to implement each and every strategy for patient safety. And unless we have local people who are working in hospitals, in healthcare, with organizations on the ground, we will not be able to reach to every patient and every facility. So, I think initiatives of organizations at the local level are extremely important, and it doesn't need permission from member states. This action plan is everybody's action plan, because there are actions embedded in this for everyone at individual level as well as organization level, from government to government institutions to patients, patient organizations, civil society organizations, professional organizations, academic institutions, private, non-governmental, governmental, all different stakeholders. In every facility, every setting where care is provided, where a person, an individual is accessing healthcare system, that is where we need safety measures. So please, initiate and reach out. And also, if you would like to be a member of the Global Patient Safety Network, we would be delighted to have you on the network to share your local innovative solutions, which you have, taken forward in resource-limited settings in particular, so that we could learn from these examples as well. So please share best practices and your experiences, and we'll be very happy to have you on the Global Patient Safety Network, which is a vibrant network to share information in real time.
It's fantastic. We have two one small question and one a little bit bigger question from Dr. Ebikapai Okoyen from Nigeria. The first one is, would love to know if Nigeria has adopted the Global Patient Safety Action Plan. The WHO is aware of the level of implementation steps put by the WHO to assist low-middle income countries in implementation. So the real question, I think, in addition to the Nigeria in specific, implemented, is kind of relates to the question I have. So I'll throw it in the middle of his or her question, which is, what is the implementation strategy across the world? It's kind of difficult with every different country having a different structure. There are places where you have a very effective Ministry of Health that can say, this is the new standard of care, you need to do it, or else you get slapped on the hand or you don't get something. But in countries, for example, like in the US, where we do have, the Joint Commission, we do have the Department of Health and Human Services, but the influence on the hospitals is much more soft, per se. So if you share with us the implementation strategies that the WHO is using in different countries.
Absolutely vital question. So I would say the overview of the implementation strategy is already embedded in the action plan. I briefly shared during my presentation the ecosystem in which we are recommending to implement. But when you get into granular details, we actually are working through several channels. And in August, actually, we organized a major consultation, which was at the launch event. This consultation was to bring together key stakeholders and exactly discuss this. How do we implement the action plan? So we had 8 working groups working into taking these 4 partners and 4 group of partners and the 7 strategic objectives. How should we take it forward? So there were some very important key lessons which came, and we actually putting together an implementation guidance, which would provide very detailed step-by-step, approach to how do we take forward the implementation. But I would share here with you that we are in WHO formal mechanism. We are reaching out to all our regional offices as well as country offices. And actually this morning itself, we were discussing with our Africa regional office, how do we take forward the Global Patient Safety Action Plan in all countries in Africa? So we are now working on a strategy to formally reach out to the governments in each country, and then seek their commitment and support to prioritize patient safety, as well as create mechanisms such as organizing or establishing a national patient safety committee, a steering committee. Also developing a broad action plan which will start the action on patient safety. So taking action at governmental, at the national level, and also directives to healthcare facilities, as well as to different partners to get engaged in this process. Similarly, we are also outreaching to professional bodies and international organizations through their networks to start implementing so that they can influence their membership as well. So multi-pronged strategy again to implement. Detailed guidance on this would come up, of course, but as of now, we are approaching through our partners and through different organizations to work with the member states to implement it.
Neelam, I'm going to give you an impossible task because we're coming on in time. I'm going to give you 2 questions. I want you to answer them in less than 30 seconds. One from Dr. Nahal Elias. I think he's in Boston. He's asking, how do you address issues related to transitions of care across systems, physician shifts, and your WHO initiatives? And the second question is, what is the WHO's take on healthcare disparities and racial inequities impacting patient safety? I know it's impossible, but you have 30 seconds to answer. There's a lot of complimentary comments as well, but I'll send you these later. So 30 seconds for your answers.
Thank you. I think just on the transitions of care, again, they are at the global level, WHO is giving guidance and developing policies. So, for example, electronic health records is something which is really provide a thread between different levels of healthcare. So how do patients actually become the actual owners of the records, so that when they move from one facility to the other, the transition is actually addressed, and particularly in relation to medication reconciliation, for example. Unless we make sure that the medication per patient is taking, they are, it's difficult to ensure the harm, reduce the harm in transition of care. So example of one is medication reconciliation to reduce harm related to transition of care. But there are several strategies coming forward in this area, and we have a full department working on healthcare delivery systems. So I will not be able to answer in 30 seconds, but I can share with you all the guidance and work we are doing in this area. Health equity is also an extremely important area. This is actually a theme of World Health Day this year. So globally, a huge level of advocacy as well as guidance is provided in this area. But the action actually has to be at country level and partners and health facilities. So I think we sort of, WHO is put on spot in, how do you actually take it forward? But the action has to be taken by all key stakeholders in this area.
Dr. Dhingra, I'm going to use this as an excuse to say we need to bring you again, because there's so many questions that people are so engaged and so complimentary of your talk. I want to personally apologize to Dr. Asma Adnan for not being able to answer her question. But I also want to say thank you so much. This was absolutely mind-blowing in terms of an eye-opening for many of us. So thank you so much, and I look forward to working with you in the very near future.
It's indeed a pleasure for me, and thank you for this opportunity.